And I don't sling mud, but I will say to you that the healthcare system that was designed was a healthcare system that we would all and should all be proud of. But it was designed by the Progressive National Party, but implemented by the British and being managed by the British. The policies that are being developed under the British administration are the policies that have been implemented by some of your own people. Some of your own people, and some of them who want to represent you. What I will say to you is that the National Health Insurance Plan, first of all, most of you can recall that the Constitution was suspended in August 2009. We had a steering committee for the National Health Insurance Plan that consisted of about 14 members. After the Constitution was suspended, the plans and division of National Health Insurance Plan changed. Between 2009 August and this implementation, full implementation, and 2010 April, things changed. And this is what changed. Let me tell you what changed. You see, I'm a man who's a health practitioner, and when I deal with health, I say I go there to look out for the interests and the health of the people. And that's what I represent. And this is what changed. Because of certain beliefs that I have. Because I don't care about the finances too much, you know. I care about the principles and the rights and certain basic rights of people. What changed, first of all, was that we know that in the old system, children under the age of 18, a person under the age of 18, children, were exempted from paying any kind of fees in our health system. And they went to the hospital or the clinics and got free health care. That principle was supposed to be upheld in the new NHIP plan, but it was not. The second principle was that those persons who are elderly, over the age of 55, also were exempt from paying fees, got free health care, because they paid their dues to society. That principle was upheld in the old system, but when the British came in, the direction changed. Also, persons who were unemployed and who were considered indigent under the old system, they were not supposed to pay anything for health care. But now, what changed was that they are now requiring persons who are unemployed beyond 90 days to pay, or not to pay, to not get covered, not receive health care under the new system. And we have lobbied day in, day out to have those particular elements change at the National Health Insurance Board, and we were denied time after time after time. They even went further than that even during their management period, after it was implemented, and after they came up with this so-called health challenge paper, to try to make a case for raising national health insurance premium from 5% to 6%, and in addition to that, now made it necessary for kids, for you to have to pay for your children to be covered. Wrong. Which is wrong. It went against all principles. And at that stage, you know what I said? Enough was enough. And a lot of persons wondered why I wanted to quit government. I said enough was enough. And the day that they decided to raise that national health insurance fee from 5% to 6% was the day that I was outside on the streets, one man demonstrating against the administration, while persons who want to represent you now in your constituency of Caicos was in there approving that deal. They were in there approving the increase in National Health Insurance Plan and increasing and making it necessary for you to pay for your kids. And they are approving it while I was outside standing, demonstrating against them, asking them and the governor to resign. Check the dates if you don't believe me. Because enough was enough. There's certain things I couldn't stand for. The hospitals, same thing. A plan designed by the PNP government, implemented by the British administration, and the one thing that they did, all they want to do is try to raise taxes so that they can pay for them instead of controlling expenditure, instead of finding out what they are doing or not doing and serving our people, and implementing the part of the contract that require them to force them to give proper care to our people. And that is what they're failing to do. So from day one, what we are going to do in day one to look at is that no child will be, you will not have to pay for any kid, for any national health insurance plan coverage under a PNP government. You will not have to pay as an unemployed person for any kind of health care in this country. You will not, as a citizen, as a senior citizen, will not have to pay for any kind of health care because you've served your time. And that hospital, they will be forced to abide by the contract and provide the services that are expected to be provided on the expectation of the people. And if they fail to provide it, as Royal say, they will be fired.